welcome to Aging Matters, a program featuring individuals who talk about aging-related topics of interest to older adults and their families. I'm Cheryl Bebersdorf, your host. Stroke kills about 140,000 Americans each year. That's 1 out of every 20 deaths. Someone in the United States has a stroke every 40 seconds. In fact, every 4 minutes, someone dies of stroke. Knowing the warning signs and symptoms of stroke is critical so you can act fast if you or someone you know might be having a stroke. The chances of survival are greater when emergency treatment begins quickly. Today, my guests are April Seely and Alexandria Adamonis, registered nurses who work on the stroke unit at Virginia Hospital Center. April and Alex will tell us what we need to know about stroke and especially how to recognize signs and symptoms that may occur when someone is having a stroke. They're also going to be talking about recovery and rehabilitation after a stroke and how to prevent it. Later in the program, April and Alex will present a short demonstration of what to do when someone is showing signs of having a stroke. So thank you, April and Alex, for joining me today.
Absolutely. Thank you so much for having us.
Yes, thank you.
Well, let's get started by getting an overview of stroke. I think it's really important to understand everything possible about stroke so that we know how to prevent it, and we'll get to that later. So, Alex, let's start with you. What's happening to a person when he or she is having a stroke?
So typically it's a disease where the arteries of the brain are involved and the blood flow is interrupted and the brain is not getting the oxygen that it needs.
It's just as simple as that.
It is as simple as that.
And so, okay, April, then what causes the stroke?
Well, the strokes are usually caused for an occlusion that happens in the artery of the brain from like a blood clot, or can also happen from a leak or a rupture in the arteries in the brain.
And when you say occlusion, can you explain what that means?
A blockage of the artery from the blood clot in the brain.
Okay, and it is a very sudden thing.
Yes.
It sounds like.
Absolutely.
And are there different types of strokes? I'm thinking, well, could there be some in the back of your head as opposed to the side, different blood vessels? Talk about the different types.
Yeah, so there's actually, the first one I would like to talk about is transient ischemic attack. So this is typically known as like a mini stroke. This one is kind of a warning sign to a larger stroke to come. Mm-hmm. Usually the symptoms resolve very quickly, but it's definitely a red flag that we need to get on medications to help resolve this and prevent a future stroke.
This is what's known as a TIA?
A TIA, yes.
Okay.
So mini stroke, if you will.
All right.
So this one, it's, like I said, resolves pretty quickly on its own. But
how long does it last? I mean, what are we talking about?
It depends on the person. Could be like an hour or so. Yeah,
oh, an hour.
Very, very fast to resolve, but very large warning sign.
And what's happening during a TIA? Can you explain that?
Same symptoms as a typical stroke. Mm-hmm. However, they just resolve very quickly.
Okay.
And this is if typically if there's not enough oxygen getting to the brain, but it's maybe not a large enough clot that there's still a little bit coming through, and then it resolves. Mm-hmm. And then the other strokes would be an ischemic stroke. This one is when a blood clot is blocking the artery, and it causes decreased oxygen to that part of the brain. This one, usually symptom management for this, we actually want the patient's blood pressure to be fairly high, which is kind of an odd thing to think.
Yes. Why is that?
You would want the blood pressure to pump very hard and fast to get more oxygen to the brain. Mm-hmm. And then lastly, there's hemorrhagic stroke. This is still considered a stroke. This is when an artery in the brain actually bursts. These ones are usually a little bit more severe, And with these ones, management-wise in the hospital, we keep their blood pressure obviously quite low because we don't want it to bleed out more and cause more pressure.
Now, you've given 3 different kinds. Is one more common than the other?
Absolutely. So ischemic strokes, and that kind of involves the TIAs or mini strokes as well.
Right.
That accounts for about 87%. Whereas the hemorrhagics are much rarer. They're about 13%.
So you said there's the TIA, and then there's the ischemic, and then the hemorrhagic.
Correct.
So, and talk a little bit more about who is affected by this. I mean, we've been hearing so much recently about Luke Perry, who was 52 years old, and everyone was surprised that he was too young to be having a stroke, or at least one would think. But talk a little bit more about age as to these 3 types of strokes. To whom can they, or where can they occur?
It can literally happen to anyone.
Anyone can have any of these?
Oh,
Yes.
absolutely. I have actually had a patient a few years back that had a hemorrhagic stroke. It was really unfortunate, actually. She had a cold and had sneezed. It must have been a very violent sneeze, but she had sneezed very hard, and one of her arteries in her brain actually burst, and she had a hemorrhagic stroke.
My goodness.
Luckily, her only symptom was a severe headache, so thank goodness for that. But
Sure.
yeah, it can. She was young. We've even had people in their 20s on our unit.
20s on the unit.
They'll have like a clotting disorder, or which we'll get into more symptoms or risk factors later. But
Right, and in fact, that's a good segue. So, April, so let's talk about risk factors, lifestyle risk factors. What causes a stroke? Who's more likely to get a stroke?
People with very sitting around a lot, not active lifestyle, high fat diets that will lead to obesity, which can lead to high cholesterol, high blood pressure, diabetes, smokers, that's another risk factor of it. Your family history can be one also of it. Some of the factors that we can't change, those are ones we can, but ones we can't are our age and our race. African Americans are known to be twice as likely to have a stroke than others.
All right. And are there medical risk factors as well that can, you're talking about lifestyle risk factors and that. Are there?
The medical would be like a clotting disorder that would, like AFib, can cause clots that could also travel to the brain. But your high cholesterol, blocking your arteries that away, your high blood pressure, which could cause the bleeds for the hemorrhagic strokes.
Would you both say that the older you get, the more at risk you are of that
Absolutely.
age is actually a factor?
it
Yes.
is, yeah, most definitely. And I would say out of those risk factors, it's probably blood pressure and the atrial fibrillation are 2 of the big ones.
Yes.
Really?
Yeah, that cause.
So this is really important to keep
manage
that under
those,
control.
absolutely.
Yes, manage your-
Exactly. Well, the thing that I want to hear from both of you, but we'll start with you, Alex. What are the signs and symptoms of a stroke?
So there's several. Somewhat, it depends on where the stroke is, but typically someone will have weakness or numbness on one side of their body. You'll notice their balance is kind of off. They may have visual difficulties. A lot of times they'll have either double vision or they can't see very well out of their peripherals. Their face will kind of be drooping.
One droops on one side.
So
yes.
typically I'll ask someone to smile for me, and I'll actually count their teeth to see if it's symmetrical or not. Like, oh, there's 5 on that side. Oh, I can only see 3 over here. There's a droop there.
Because there's drooping.
Yeah.
Okay.
I usually ask them to raise their arm up for me. If it starts to drift down, that's another sign because of that weakness on one side or the other. Their speech is usually slurred. They may be confused or also having difficulty understanding as well.
and there's a mnemonic, how is it pronounced? Mnemonic?
Oh yeah, pneumonic. Yeah.
What, since I'm assuming, and we're going to be seeing this a little later, what should people remember? What are those letters that really describe what you were just talking about?
Oh, absolutely. So a good way to remember it is be fast, because it is very important when you're dealing with a stroke to get the person to a hospital quickly. So be fast is a very good acronym.
And say that again, and what BEFAST?
BEFAST.
Right, and B is for?
B is for balance. So like I said, you'll typically see someone kind of stumbling a little bit,
Right.
typically because they have that weakness. Then eyes would be the E.
E, yes.
So that's the visual difficulties, and that can also kind of go into balance too if you're not seeing properly, kind of stumbling around. The F would be the face. So you're looking at someone's face, seeing if there's that facial droop.
All right.
And then the A, the arms again, they might be drifting down.
Right.
That's another good way to assess very quickly whether or not you're seeing signs of a stroke. And then the S would stand for speech or slurring. So typically someone will be slurring, they're not really making much sense, so you're going to take a look at that. And then the T actually stands for time.
Which is what you need to do.
Absolutely.
Right, you need to follow up. And is it likely that someone would have all of the symptoms that you're describing, or would you say that depending on the stroke would sort of determine what the symptoms were?
Depends on the person and
Depends
where
on
it is. Yeah.
the area of the brain that's affected will usually lead us to what is being affected, from
Okay.
motor control to speech, memory.
But kind of remembering be fast kind of covers it all.
It does.
Yes.
And that way you know that if there's enough of those letters or the
If
symptoms.
there's at least one,
Yes.
that means take the time and get seen. We don't have to have all of them, or even majority of them. One or two would be want you to go to the hospital to be checked out as soon as possible.
And why is that so important?
Because you're racing a clock. We only have a limited amount of time from the time the symptoms begin to do certain treatments. And those treatments, once the time runs out, we can't do those treatments any longer. We have to fall back on other ones that are, the first one could have been a better result than what the second ones would be.
And I would assume that it's really important at home to call 911, not drive yourself to the hospital.
Please do not drive yourself to the hospital.
Okay.
Do not drive yourself to the hospital, and if at all possible, do use an ambulance. They will get you there faster because
right.
you are racing this clock.
And what kind of a time span are we talking about? I've heard of the golden hour. Is that about right, or is it several hours? What would you say?
Get there as soon as you can. There is like that golden hour. I know with the TPA that's given, we have a 3-hour time.
3 hours.
We have 3 hours to initiate it.
And when CPA, what does that mean?
TPA, it's the
It's the clot buster.
it's a clot buster drug.
Okay.
Yeah,
It's a medication.
It is a
It's
medication
a
that's a clot buster drug.
Okay.
You have 3 hours from the first symptom.
Okay.
To get that started. Yeah.
And so, what are the possible complications of a stroke? I mean, if you don't get to the hospital in time, or if people, I'm imagining that sometimes people might say, well, maybe it is, maybe it isn't, and they delay. So, what kind of complications? Alex, you tell us about that.
Yeah, I see it a lot actually, and it's very unfortunate because disability caused by stroke is huge if they don't get them to the hospital in enough time. Typically you'll see the person, they do have that weakness, so it's going to take quite a while of rehab to get them back on their feet and get them closer to their baseline. So definitely weakness. They may be depressed. And nutrition is a big factor too, because sometimes people with strokes will have difficulty swallowing. And then, in more extreme cases, if after a couple of days, if they're still having trouble with the swallowing, we'll do a nasogastric tube through the nose into the stomach to give them food through there. But that's kind of a temporary fix. Can usually only have those for about a month. So if it looks like, in the long run, they're not going to be able to swallow, then we do a gastric tube and feed them through there.
So the message is get there, get to the hospital as soon as possible.
Absolutely.
Yes.
If there's one thing I would want the viewers to, take home from this is if you're showing even one sign,
Go.
go to the hospital.
Go to the hospital.
Get checked out.
Okay. Well, we're going to see a situation where a mother and her adult daughter are enjoying an evening together when suddenly the mother shows signs of having a stroke. Her daughter's knowledge about the symptoms and taking immediate action may actually save her mother's life. Let's watch.
Oh, I just had this really bad headache, and words just kind of got all blurry all of a sudden.
You okay?
I don't know. It's just so bad. Just this like I don't know.
Mom, are you okay?
Yeah, I'm okay.
Can you smile for me?
I am smiling.
Okay.
I'm trying.
Okay. Can you
What's
raise your
going
arms
on?
up for me?
I'm
Can you raise this one?
I'm trying.
Repeat after me. 50-50.
50-50. What's
Okay.
going
I think you're having a
on?
stroke. I think you're having a stroke, Mom.
I'm confused. What's going on? I'm just a really bad headache.
Hi, I think my mom is having a stroke.
Really bad headache.
She's having a headache. Her vision is blurry.
Yeah.
Her speech is slurred.
So blurry.
One side of her body is really
Are
weak.
so blurry. You're
I'm-
kind of blurry.
I'm really scared. Please send an ambulance.
I hope that you will appreciate the scenario that you just saw and how important it is to recognize the symptoms of a stroke and the timeliness of the daughter's action of calling 911 and getting her mom to the hospital. It's really important. So we wanted to ask you a few more questions, Alex and April. How can strokes be prevented? What do you tell your patients at Virginia Hospital Center? Alex, well, let's start with you.
Yeah, absolutely. So I usually, try to encourage a more active lifestyle, cutting down on the fatty foods. I know, we as Americans tend to like fatty foods, but cutting back on those, getting more exercise. If the person smokes, trying to
Stop.
do cessation of the smoking,
Sure.
because that puts you at very high risk of developing clots. Alcohol, either limitation or cessation as well. And definitely, probably the most important thing is to take medications that are prescribed.
Oh, okay.
That's my number one when I'm telling my patients.
And so, in fact, April, I was going to ask you about that. So there are certain medications then that stroke patients usually are on after in the recovery period?
Yeah, you're going to want your medications to control your blood pressure, your medications to control your cholesterol, and any medications to help with your AFib, which would be for anticoagulants to help prevent any further blood clots. If you're a diabetic, definitely being on your diabetic medications are some of the main ones that we would make sure that you would go home with education on, and highly encouraged to maintain these. This is what's going to help with your preventing of a future stroke.
Since blood pressure is so important, I just have to ask, I guess it's partially because I have a nursing background, what is the blood pressure that is ideal? Is it still 120 over 80, or is there some variation?
It is. Yeah.
It still is 120 over 80. And the other thing is that what has been your experience on the stroke unit? Are some sense of how many people have another stroke? Does it happen often?
Oh,
Is it because of not adhering to a better lifestyle, or are there other factors? What would you tell us?
Typically, when I see someone get readmitted with a stroke, it is because they see their medications, they're like, oh, I don't really, think I need to take this anymore. And then bam, they'll have another stroke.
Really?
That's why I always emphasize how important it is to, when you're prescribed these medications, how important it is to take them to prevent strokes.
And are we still talking about people of all ages?
Oh, all
All
ages.
ages, yes.
So it's that new lifestyle is really the factor that really makes the difference.
Absolutely.
Wow.
But of course, all those other, lifestyle factors
The lifestyle
go into effect
changes.
as well. But I have to say the medications is very important.
So, but you mentioned a little bit about stroke recovery and rehabilitation. Can you both talk? Alex, why don't you start? But what happens on the stroke unit at Virginia Hospital Center? What's the goal here? How long do people stay? What is the treatment modality each day? Can you talk about that?
Yeah, so typically when someone comes into the emergency room with stroke-like symptoms, they'll immediately get a CT or a CAT scan to check to see if there's any hemorrhaging, any, blood clot, or not blood clot,
Bleeding.
bleed in the brain.
Okay.
And then from there, they'll do an MRI to see if there is a blood clot and how significant the damage has been. They'll have physical therapy, which will help them, get their muscles trained again and get them strong. Occupational therapy helps with kind of adjusting their activities of daily living to their possibly new disability. And then they have speech work with them as well. They work on not only speech, but swallowing as well, which, like I said earlier, can be a huge factor
Sure.
in nutrition and everything.
And the length of stay in the hospital is about how long?
About 3 days.
Two
So,
or 3 days.
3 days, depends on how, that we have a set of tests that they run through, and then at the end of them, they usually, then we'll go to a rehab facility if
Okay.
needed, or they can have home physical therapy and occupational therapy come to the home if they're at a higher functioning.
And is the rehab facility part of the hospital, or is that usually elsewhere where they go for
There's
rehabilitation?
both. The hospital one is
Okay.
a lot more intense. You have to be able.
very good, though.
It's very good though.
Okay.
But it's some people due to their disabilities can't tolerate the higher intensity that our inpatient rehab will do, and then they'll go to a SNF or a skilled rehab,
Skilled nursing
a
facility.
skilled nursing facility
Okay.
for rehab there for however long it takes, and then home usually after that.
And one question I had too is, are most of the admissions to the stroke unit directly from the emergency room?
Most.
Yes.
Sometimes we will be getting, if someone came in, got the TPA, the clot buster, they'll go to ICU to be
initially.
To be more closely monitored, and then once they're stable enough, they come to the stroke unit.
Okay.
But we do get a lot from the ED.
Yeah. I mean, I would imagine that everything works very fast.
Oh,
Yes.
As you say, from the time the person comes to the hospital, because time is really
You're on
critical.
that clock. That
Yes.
clock runs out at 3 hours from the first symptom, and a lot of things are going to happen very, very quickly as soon as you get to the hospital.
wow.
There's going to be asking you a lot of questions and a lot of things and a lot of tests being done right away to make sure that first you are appropriate and within the time limit for that TPA, and to get that initiated to start getting that taken care of, the clot taken care of, or if another treatment needs to be done.
All right. Well, April, I was going to ask you if I'm sure you do a lot of teaching, I'm sure you both do on the unit, but when you have the chance to talk with people, what are the best resources for teaching people about stroke and all the things that we've talked about today?
There's a stroke.org has a lot of good things. There's the Virginia Health Department has some information. CDC has information on it.
Centers for Disease
Yes,
Control
yes.
and Prevention,
Yes,
right?
they have things and all. American Heart Association and Stroke Association also has information on it.
Well, I know that when I was preparing the questions for today, there was certainly a lot of information on the internet.
There is, yes. And
Absolutely.
you put in stroke, and it's going to give you the symptoms and the possible treatments and kind of what they are.
And so we're going to say that one more time. So what should we remember about the signs and symptoms of a stroke?
Be fast.
And
B is your balance. I is your eyes for blurry vision or black spots. F is for your face, for your facial droops. A is arms. Look for a weakness or even paralysis in one arm. S is for speech, either garbled words or a slurring of your speech. And T is the most important is your time.
all right. Well, I want to thank April Seely and Alexandria Adamonis, registered nurses from the Virginia Hospital Center Stroke Unit, for joining me today. This program is broadcast Sundays at 5:30 p.m. and Wednesdays at 6 p.m. on Comcast Channel 69 or Verizon Channel 38, and these channels are in Arlington, Virginia, or you can stream live at those times on www.arlingtonmedia.org. You may want to know that Aging Matters is also on the radio. That program is broadcast every Tuesday at 2 p.m. on WERA-LP Arlington, 96.7 FM. And you can listen to all previous Aging Matters radio programs by visiting www.mixcloud.com/Aging Matters. And finally, both radio and television Aging Matters programs are posted on our Facebook page, which is www.facebook.com/Aging Matters WERA. I really want to thank you for watching Aging Matters today, and until the next time, remember, age is just a number, not a label. I hope you can join me again on the next Aging Matters program.